What? Every day.
Not every week.
What? Every day.
PPE. Every day.
I'm here today because we have a very specific concrete set of demands that would directly improve our working conditions. But we also have a series of political demands. We're demanding that Governor Cuomo stop these outrageous Medicaid cuts that he's proposed. They'll directly affect the funding of our hospital system. They'll directly affect the lives of our patients. But my hope personally is that we will have a broader conversation about nationalizing the healthcare system so that we can have the centralized coordination of resources as opposed to this disjointed, public-private thing that's going on right now, because it's not working.
I am here in solidarity with the other nurses, with the other healthcare workers who are being put in danger by the greed and incompetence of our government and of the corporations who are ruling this country. We need the Defense Production Act now. We need masks, we need ventilators, we need medications. My hospital is running out of medications. We need cleaning wipes, we need gowns. We need these things in mass production. Companies must not profit off of our deaths. This is a poster that says all or many, definitely not all, of the healthcare workers who have died so far in this country because of the incompetence and greed of our government. We need help. I'm not a hero. I don't want to die for this.
This isn't people sacrificing themselves like the corporate media likes to portray it, like they're some type of victims. These people are being killed by a for-profit healthcare system and a capitalist economic system that cannot provide and will not provide the adequate supplies that are needed. The unions throughout New York City and throughout the country need to take up the demands that the frontline healthcare workers are making.
We want the equipment to protect ourselves so we can be alive and take care of more patients. We are nurses and we want to take care of the patient and any patient, of course, but we want to be alive and take care of more patients.
We're still working every day without the supplies that we need, and we know that we're going to start seeing more of these patients. We know that their situation is getting worse every day, and we just feel like we're going into work completely unprotected, and we're watching our coworkers start to get sick. We've had coworkers already die, and we just feel that the public needs to know that we're not just martyrs here. We're trying to do a job. We're trying to take care of patients as best as we can, and we can't allow ourselves to just become these faceless names. Like we are real people, and we're trying to help as best as we can, and we're being essentially told to do it without any protection. So
personally was fired early in the rise of the pandemic from Mount Sinai Hospital for advocating for my own medical concerns with my own medical conditions, and with that involved the rationing of PPE, etc. And then I'm also appalled that the governor and everybody's calling on frontline workers from everywhere to come to New York. And then you have big hospitals and corporations who are firing the staff that they have as opposed to standing by the staff that they have. Again, we just don't have what we need, and those at the top are just not doing right by us as they should, which doing right by us is doing right by everyone.
We're here. We've been fighting for safe staffing. Cuomo never did a thing to help us with that. He now is the big man in town talking the big talk like he's out to protect us. But where is the PPE? Where are the ventilators? The governors are bidding one by one like it's still a market healthcare system, bidding for our lives. We don't have time for no prices right. We need the PPE. We should nationalize the industries now, nationalize our healthcare system. All our hospitals should be public, under our control, because we are here to protect our lives and our patients. We need to stop this pandemic. We are enraged. I'm mad right now. We are mourning our colleagues who have died already. That is a crime. That is not just a natural disaster or a terrible virus that is that is all true. But this is a crime of the system, of the for-profit healthcare system. We're here again in solidarity. COVID-19 Frontline Workers Task Force. Thank you.